The European Union is recommending new travel restrictions for American tourists as the number of COVID cases in this country surges even higher. Here to answer your questions is Dr. Preethi Mehrotra, an infectious disease specialist at Beth Israel Deaconess Medical Center. Doctor, thanks for your time.
Thanks for having me.
Yes, well, Dr. Mehrotra, countries such as France, Italy, Germany, they're reviewing the new guidance. It will be up to each government to decide whether to implement it. But why would they want to ban Americans from entering? What kind of risk are we posing right now?
I think one of the most crucial lessons from the pandemic is that we really are all connected, and international travel can play a role in global transmission. Anywhere in the world where there is a surge in cases and where there might be pockets of unvaccinated individuals does pose a risk for transmission to other parts of the world.
All right, well, the U.S. could be weeks away now from distributing the first booster shots. How quickly could those extra doses bring down our case numbers?
Vaccination really does remain the best protection, even with the Delta variant. It's difficult to say how much a third dose specifically will impact our numbers, but data from our public health partners will help to answer that question moving forward. It's important to remember that we need to continue to offer vaccine to those who haven't yet received their first dose or who still need to complete their vaccine series.
Well, we know here in Massachusetts, we have one of the highest vaccination rates in the country. Our COVID numbers are relatively low, though they're ticking up. But the situation in other regions, especially the South, is incredibly disturbing. So what worries you most about the surges in the South, those states?
It worries me too, especially in the context of the Delta variant. Anywhere there are higher percentages of unvaccinated individuals, there is increased risk for ongoing transmission. So it's important in those states to advocate for all layers of mitigation in addition to continuing vaccination efforts. And this is especially as important as what's perhaps most concerning is the staffing and bed shortages that those healthcare facilities are facing.
Well, speaking of that, some hospitals in parts of the South say they are running low on oxygen supplies. So how could that impact the care of their patients?
It's unfortunate that we might be seeing low oxygen supplies in some of those states, which we also saw in other parts of the world. Oxygen really is the mainstay of respiratory therapy for individuals with illness from COVID-19. So such shortages really do carry great clinical impact.
All right, Dr. Preethi Mehrotra with Beth Israel Deaconess Medical Center. Dr. Mehrotra, thanks for your time.
Thank you.
Yeah.